Hello and welcome to today's discussion on conjunctivitis, a common eye condition that affects people of all ages. Before we begin, I would like to ask you to please subscribe to our channel to stay updated on our latest videos and content. Conjunctivitis, also known as pink eye, is an inflammation of the conjunctiva, a thin, clear membrane that covers the white part of the eye and the inner surface of the eyelids. Knowing how to spot, prevent, and treat conjunctivitis can help you protect your eyes and avoid complications. So, if you're dealing with conjunctivitis yourself or you're interested in learning more about this common eye condition, please subscribe to our channel and let's get started. The conjunctiva is a translucent mucous membrane that lines the posterior surface of the eyelids and the anterior aspect of the eyeball. Inflammation of the conjunctiva is called conjunctivitis. It can affect one or both eyes and is typically characterized by redness, itching, tearing, and discharge. There are several different types of conjunctivitis, including bacterial conjunctivitis is caused by bacterial infection and typically results in thick, yellow or green discharge from the eye. Viral conjunctivitis is caused by viral infection and typically causes redness, tearing, and a watery discharge. Allergic conjunctivitis is caused by an allergic reaction to pollen, dust mites, or other allergens and typically results in itching, tearing, and redness. Chemical conjunctivitis is caused by exposure to irritants such as cleaning products or chlorine. Cicatricial conjunctivitis is a chronic and progressive form of conjunctivitis. In today's video, we'll only talk about bacterial conjunctivitis. Bacterial conjunctivitis is a type of eye infection that is caused by bacteria, such as Staphylococcus aureus, Staphylococcus epidermis, Streptococcus pyogenes, Streptococcus pneumoniae, Haemophilus influenzae, Moraxella lacanata and Neisseria gonorrhoeae. Bacterial conjunctivitis is highly contagious and can be spread through direct contact with infected eye secretions or contaminated surfaces. It can also occur as a secondary infection following a cold or respiratory illness. Depending upon the causative bacteria and the severity of the infection, bacterial conjunctivitis may present in different clinical forms: acute bacterial conjunctivitis, hyperacute bacterial conjunctivitis, chronic bacterial conjunctivitis, and angular bacterial conjunctivitis. Signs and symptoms may vary among the four clinical types. Some of the most commonly presented symptoms are redness, swelling, itching, and mucopurulent discharge. Other common symptoms include eye pain, sensitivity to light, and blurred vision. The diagnosis of bacterial conjunctivitis typically involves a comprehensive eye exam and a review of the medical history and symptoms. The healthcare professional will examine the eyes using a special microscope called a slit lamp to look for signs of inflammation, such as redness, swelling, and discharge. To confirm a bacterial infection, the healthcare professional may perform a culture and sensitivity test. During this test, a small sample of the discharge from the eye is collected and sent to a laboratory for analysis. The lab will identify the type of bacteria causing the infection, which will help determine which antibiotics are most effective against it. It's important to consult a healthcare professional as soon as possible if there is a suspicion of bacterial conjunctivitis, as early diagnosis and treatment can help to prevent complications and reduce the spread of infection to others. The treatment of bacterial conjunctivitis typically involves the use of antibiotic eye drops or ointments, or even oral antibiotics in some cases, to kill the bacteria causing the infection. Ideally, the antibiotic should be selected after culture and sensitivity test, but in practice, it is difficult to do so, as stopping the spread of infection is very critical. Depending on the severity of the infection, your doctor may prescribe a single or multiple-day course of broad-spectrum antibiotics such as chloramphenicol, gentamicin, or tobramycin. It's important to follow your doctor's instructions carefully and complete the full course of treatment, even if your symptoms improve before the medication is finished. This can help prevent the infection from recurring or becoming resistant to treatment. In addition to antibiotic treatment, there are some other measures you can take to help relieve the symptoms of bacterial conjunctivitis and promote healing. These include applying warm compresses to your eyes to help reduce inflammation and soothe discomfort. Frequent eye wash, as was advocated earlier, is however contraindicated as it will wash away the lysozyme and other protective proteins present in the tears. Wearing dark goggles will help prevent photophobia. No bandage should be applied to the eyes as exposure to air will keep the temperature low, which inhibits bacterial growth. Do not use steroids as it will cause the infection to flare up and may cause a bacterial corneal ulcer to develop. Wash your hands frequently and avoid touching your eyes to prevent the spread of infection to others. Avoid contact lenses and wear glasses instead until the infection is cleared. Avoid sharing towels, handkerchiefs, and pillows with others. In conclusion, conjunctivitis is a common eye condition that can be caused by a variety of factors. Knowing how to spot the symptoms, preventing the spread of the infection, and seeking appropriate treatment can help you manage the condition and protect your vision. If you suspect that you or someone you know has conjunctivitis, it's important to contact your healthcare provider for an accurate diagnosis and treatment plan. With proper care, most cases of conjunctivitis can be resolved quickly and without complications. If you enjoyed this video, be sure to give it a thumbs up and subscribe to our channel for more informative videos like this. Also, I'd love to hear your suggestions on topics you'd like me to cover in our future videos. Let me know in the comments section, and I'll do my best to make it happen. Thanks for watching.